Identifies self by name. Identifies the resident by name. Washes hands. Explains the procedure to the resident, speaking clearly, slowly, and directly. Maintains face-to-face contact whenever possible. Provides privacy. Adjusts the bed to a safe level. Locks the bed wheels. Positions the resident in a supine position. Exercises are done by the resident with some assistance and support. The resident uses a stronger opposite arm or leg to move each of the joints of a limb that is incapable of active motion. Has the resident repeat each exercise at least 3 times. Performs the following movements properly. For the shoulder, extension, flexion, flexion, extension, flexion, extension, flexion, extension. For the shoulder, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. Performs the following movements properly. For the elbow, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Pronation, supination, supination, pronation, supination, pronation, supination, pronation. Performs the following movements properly. And for the wrist, flexion, dorsiflexion, flexion, dorsiflexion, flexion, dorsiflexion, flexion, dorsiflexion, flexion, dorsiflexion. Radial flexion, ulnar flexion, radial flexion, ulnar flexion, radial flexion, ulnar flexion, radial flexion, ulnar flexion. And for the thumb, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. Opposition,
opposition, opposition, opposition, opposition.
Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Performs the following movements properly. And for the fingers, flexion, extension, flexion, extension, flexion, extension, flexion, extension, abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Performs the following movements properly. And for the hip, abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. Performs the following movements properly. And for the knees, flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Performs the following movements properly. Ankles, dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Dorsiflexion, plantar. Dorsiflexion, plantar flexion. Supination, pronation. Supination, pronation. Supination, pronation. Supination, pronation. Supination. Performs the following movements properly. For the toes, flexion, extension, flexion, extension, flexion, extension, flexion, abduction, 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 abduction. When exercises are completed, returns the resident to a comfortable position and covers as appropriate. Returns the bed to the lowest position. Places the call-light within the resident's reach. Washes hands. Documents the procedure. Notes any decrease in range of motion or any pain experienced by the resident. Notifies the nurse if increased stiffness is noted.